Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section, we discuss about etiology of coldness in the human body. In previous section, I mean the section of the causes of warmness, you became familiar with some causes of coldness. For example, too much movement. Too much movement by consuming too much innate heat to produce too much speed for movement without enough replacement, the body become cold. Also by stillness and no need to increase the activity of heart, no need to increase the production of spirit, the body become cold or cold distemperament will happen. Too much heat, contacting with too much heat, for example, a long bath by causing puffiness in the body and opening pores of the skin, help to vapors exit easily from the body. Also, spirit easily dissolves through these channels, through these pores, especially when the person after a long bath, long hot bath, come out without enough covering. Not only the vapor and spirit exit from these pores, but also the coldness of the air easily enter, and the consequence will be cold temperament or cold distemperament of the body. You, when faced with these patients, usually you see some cold distemperament, for example, cold headache, a headache that treat with warm agent easily, and a puffiness in all of the body of the patient. If you take a careful history, you can see that this person like long bath. Of course, this person have benefit from long bath because during bath the warmness come inside and the person feel better. But every time that he or she give a long bath, more puffiness and more opening of the pores of the skin will be the consequence, and the disease become worse. Too much eating, I mentioned it before in previous section. Too much eating can strangulate the heat, can cause consumption of innate heat too much without enough replacement, without enough production of sanguine. Usually the most humor from too much eating is the phlegm, the cold and wet humor. And the consequence with this three way will be coldness of the body. Starving or little eating also by causing little amount of sanguine humor or other warm humor, and little amount production of spirit cause coldness of the body. Meeting cold things, for example, meeting cold water, bathing in cold water, swimming in cold water, going out in cold air, especially without cover, or those person who have weak spirit, like elderly people, or those who have a puffy with open pore body. that coldness come rapidly inside and cold their organs. This is a cause of coldness of the body. Consuming cold temperamental food or cold medications that after digestion turning the temperament of the body toward coldness, and obstruction of pores of the skin for long time. In short time, I mentioned in previous section, for example, by rubbing oil all on the body, the warmness is a consequence because it traps vapors of the body and absorb their warmness and the body become warm. But after a long time, the nature of the body, for prevention of overheating, eliminate the production of spirit. So the consequence will be coldness. Too much retention and too much expulsion. Mostly wastes have wet temperament, and retention of the wastes in the body cause wet temperament, but too much retention also cause obstruction in the ways of the spirit. So the warmness of spirit could not reach to all of the organ of the body in proper manner, proper shape, and coldness will be consequence. On the other hand, too much expelling, especially expelling of warm humors, for example, sanguine humor, yellow bile humor, or too much expelling of waste, for example, diarrhea. By dissolving some spirit also cause the cooling of the body. So if you prescribe purgative agents, besides considering weakness of the spirit by taking pulse of the patient, also should notice to the coldness of the body. Coldness usually is a chronic consequence of too much expulsion, but weakness is acute consequence of too much expulsion. Some feelings in their ordinary amounts cause warmness of the body. For example, worries cause you walking around the room, cause agitation, irritation, and make your body warm. But too much worries cause coldness. It's like too much movement. Actually, feelings are movement of the soul, are the movement of the spirit. As the movement of the body, too much movement of the body cause coldness, also too much movement of spirit can cause coldness. Another feeling that cause warmness of the body in proper amount is joy. Joy, by strengthening the digestion, by improving 4 stages of digestion, cause more production of sanguine humor, more production of spirit, and cause warmness of the body. But too much joy, severe joy, and fast movement of spirit toward outside without production or without enough replacement of spirit, cause coldness of the heart and coldness of the body. And also severe frightening. Frightening, even in normal form, cause coldness of extremities. but too much frightening, severe frightening, cause uh, strangulation of the heart and the coldness of the body, even sometimes this will be the consequence. And cold job. Cold jobs, I mean the jobs that working with cold objects. For example, ice piercing for those who work in mountains, those who work in waters, in cold waters, have cold jobs, and these jobs cause coldness of the body. Another kind of jobs are those jobs who have less movement, usually desk job, behind the desk job. This kind of job, by stillness, cause coldness of the body. What's the benefit of understanding the causality of warmness and coldness? Sometimes without prescribing any drug, without prescribing any food, without prescribing anything, only by taking a simple history and correcting the wrong manner, correcting the causality of cold or warm distemperament, you can treat the disease. And also, sometimes you have to prescribe some drugs, some medicinal food, or prescribe some manners. But by understanding the causality, the other causality of cold and warm distemperament, you can teach the patient to avoid of other causality of his cold or warm distemperament.